Christy. I will be your nurse for senior nurse for today. And I heard you're complaining of pain due to your rib fracture. Can you please tell me your full name?
Miriam Adib,
Yeah, can you please tell me your date of birth?
1st of January 1969.
Yeah, and your medical record number is 174963. And Miriam, do you have known allergies?
No allergies.
Okay. Yeah, so I will come back to you, Miriam, and I will just get your medication. So I'll just keep your bottle here. If you need anything, just let me know, okay? I'm coming back in a while. Thank you. Second RN? Yeah. Can I just validate this order for my patient? Because I have a patient here, Miriam Adi. Her medical record number is 174963. Date of birth is 7th of the 1st, 1969. And she doesn't have any known allergies. And she's ordered of PCA IV morphine. Concentration is 1 milligram per ml. Number of series is 3. PCA dose 1. Blackout interval of 5. Basal interval of 0 and hourly dose limit of 12. And this is the signature of the doctor, Dr. Han. Yeah. And she's also ordered of antiemetic metoclopramide. Dosage drug is 10 milligrams per IV. Interval is TDS. And it is signed and dated today. She's also ordered of naloxone just in case she gets overdose of the morphine. And the dose of her naloxone is this is the dose of the naloxone IV, and interval is 2 to 3 minutes. Signature and date the doctor prescribed this medication. So it hasn't been signed. It hasn't been signed, so it hasn't been given. Yeah. So I will just prepare I will just get my things. And it shows here that morphine is for moderate to severe pain. And the adverse effect of morphine is respiratory depression, nausea and vomiting, and that's it. So can we just go to to get our SA drugs? And I have prepared my other equipments here, so we'll just go there to get the morphine. My order of morphine is 50 milligrams per 50 meals. So in our cupboard we got here morphine sulfate, 10 milligrams per ml. So I need 50 milligrams. So 1, 2, 3, 4, 5. So I have here morphine sulfate for injection, 10 milligrams per meal, which will expire on the 10th of the 20, and morphine sulfate injection, 10 milligrams per meal, which will expire on the 10th of the 20, morphine sulfate, 10 milligrams per meal, which will expire on the 10th of the 20, morphine sulfate, 10 milligrams per meal, which will expire on the 10th of the 20, morphine sulfate, 10 milligrams per meal. So I am ordered of 50 milligrams, so I will use 5 morphines, 1, 2, 3, 4, 5. So from this paper, I will just write the patient's name. Today is 15th of March 2017. Now it's 14:15. Miriam Habib. I got here 5. And then, so nothing is left. So 0. Name of the prescriber is Dr. Han. And can you please sign this for me? So I received, yes. Okay, that's it. We got here 1, 2, 3, 4, 5. Yeah. Let's go to the patient, as per my computation. I got so 50 milligrams is ordered. Yes. So as per my computation, we are ordered of 50 milligrams, and our stock is 10 milligrams per meal. So 50 divided by 10, 5 meals. Okay. So I have gathered all my equipments here. So shall we just proceed to the first blood check? Yeah. So I have here the medication for Miriam Adib, and my patient Miriam Adib, medical record number of 174963, date of birth 7th of the 1st, 1969, and she's due for morphine now. So we got the order here, morphine 50 milligrams per meal, and I have here, as per my computation, I will be needing 5 because the stock dose we got here is morphine sulfate 10 milligrams per meal, 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 and morphine sulfate 10 milligrams per meal, which will expire on the 10 of the 20, 10 of the 20, 10 of the 20, 10 of the 20, 10 of the 2020. Okay, so it hasn't been signed, so it hasn't been given. Okay, so I have here also, I have here also the sodium. I have to dilute this in sodium chloride to make up the 50 mils. So I have here sodium chloride, which will 10 mils, which will expire on September 2018. Sodium chloride 10 mils, which will expire on September 2018. Sodium chloride 10 mils expires on September 2018. Sodium chloride, which will expire on September 10 mils, September 2018. Sodium chloride 10 mils, September 2018. Okay, so I will just prepare everything. Second RN. So as per my computation, we just need 5 meals. From that, so we have to discard 5 meals as well. So this is 5 meals. You're happy? Yeah. Okay. So I have to get. Dilute it with 45 mils more of the saline. At the end, you can say, do the patient one at a time. So I'm now going to take the meals. So, So I have here just discard some of that. Yep, so I have here 50 meals. So you're happy with that?
Yep.
So, okay. So I will start running my line. Yep. Can I ask for your help too?
Yeah.
Yeah, thank you. So my line is primed now. Now we'll just do my label. Can you please sign it for me? Okay. Okay. So, can we just do my second drug check? I primed it already, so we'll just proceed to my second drug check. Yeah. Okay. So I have a patient here, Miriam Adib. Her medical record number is 174963. Date of birth is 7th of 1st, 1969. And she doesn't have she got no known allergies. And she's ordered of morphine 50 milligrams per 50 meals. And I have here my morphine. I have here my morphine. 1, 2, 3, 4, 5. So she's ordered of 50 milligrams per meal. For 50 meals. So I have here each morphine is 10 milligrams per meal. So I have morphine sulfate 10 milligrams per meal, morphine sulfate 10 milligrams per meal, morphine sulfate 10 milligrams per meal. Then morphine sulfate 10 milligrams per meal, morphine sulfate 10 milligrams per meal. So I'm ordered of 50. So I got 1, 2, 3, 4, 5 of morphine sulfate. So to make the 50 meals, I diluted it with 10 milligrams of sodium chloride. So I have here the 10 milligrams of sodium chloride. So sodium chloride 10 mils, which will expire on September 2018. Sodium chloride 10 mils, which will expire on September 2018. Sodium chloride 10 mils, September 2018. Sodium chloride 10 mils, September 2018. Sodium chloride 10 mils, September 2018. And just to mention the expiration date of the morphine sulfate, 10 of the 2020, 10 of the 2020, 10 of the 2020, 10 of the 2020, 10 of the 2020. So it hasn't been signed, so it hasn't been given. So are you happy with that?
Yeah.
And we have here 50 mils of morphine sulfate. Okay. So shall we proceed to do the second drug check and third drug check? Yeah. Hi, hi Miriam, we're back here. So just to get your data, so can you please tell me your full name?
Miriam Adib.
Yeah, and can you please tell me your date of birth?
7th of 1st, 1969.
Yeah, and your medical record number is 174963. Date of birth 7 of the 1st, 1969. And do you have allergies?
No allergies.
Okay, so that's my second patient check. So shall I go to my third drug check? But before that, let me just set up my... Okay, so yeah, I'll just do my third drug check. So our patient here is Miriam Adib, medical record number of 174963. Date of birth is September 1st, 1969. And she doesn't have known allergies. And she's ordered morphine sulfate 50 milligram for 50 meals. Signature of the doctor, the name of the doctor, which is dated today. It hasn't been signed, so it hasn't been given. So we have here 50 meals of morphine, 50 milligrams of morphine sulfate for 50 meals. Yeah. So we'll set up our PCA machine. Okay, so we got here morphine. Yeah. So morphine, we got here morphine drug concentration is 1 milligram per meal. PCA dose is 1 milligram per meal. Blackout period interval is 5 minutes, and occlusion level is, so this is okay. We're set. Okay. Yeah. Ay. Mm. Okay. So morphine, 1 milligram per meal. PCA dose is 1 milligram per meal. Blackout period is 5 minutes. And occlusion level okay. And it's continuous. Loading doses, yeah. Maximum limit. She's ordered of 12, so we have to alter this. 12. Yeah. So 12 milligrams. So that's confirmed. Okay, so we're limit duration is 1 hour. PCA delivery. Okay. So next protocol. Yeah. So we're all good. Morphine 1 milligram per meal. PCA dose is 1 milligram per meal. Lockout 5 minutes. Continuous. Dose limit is 12 milligrams in 1 hour. So that's fine. We're all good? Okay. So we'll just change the syringe. This is Terumo. Okay. Start to begin PCA. So PCA is available. Okay. So just to check the side, you can, so it's obvious here that there's no signs of inflammation and there's no redness or swelling. So we just have to check with Miriam. So is it painful, Miriam?
No.
Okay. So we just have to wipe the port. So the IV is in situ, so we have to wipe the port for like 15 seconds. And then we can hook it up now. Just make sure it's locked and tape it so it won't hang. Now we can start the PCA. Yeah. Ah, okay. So it's so we can start, and the bottom. So Miriam, this is your PCA button. So for this button, when the light is steady, that means you can have your dose of your morphine. So we press it, you get your first dose, and then when the light is still flashing, that means the medication is infusing in your body. So once it stops, after 5 minutes, you can press it again for another dose of your PCA. So I'll just leave this for you, and I will also leave your bottle here beside you. So when you need anything, just let me know. I will be back after 15 minutes to check if you have any adverse reaction from the medication. Thank you. And second RN, yeah, can you please do me a favor of countersigning this paper with me? Yeah. So date up is 15 of the 3rd, and time up 14:30. So this is my initial, and your initial, please. So we are on the first syringe. Thank you.
Okay.
Yeah, so I will just clean up things that I use here. Okay, so we're all done.